Welcome to Doctor in Germany. Today we are going to talk about the topic of the Fachsprachprüfung, which is the medical German exam. But before getting into this topic, if you haven't subscribed yet to our YouTube channel, please do so by clicking on the subscribe button below. And while you are at it, please smash the like button for us as well. Whether you are planning on coming to Germany and work here as a doctor, or you are already working here as a doctor, we are working really hard to provide you with the most relevant and valuable content to help with your career here in Germany. So what is the Fachsprachprüfung? The Fachsprachprüfung is the medical German exam which will test your ability to communicate with confidence with your colleagues and with your patients. This exam is a total must before receiving your Berufserlaubnis or your German Approbation, which is the medical license here in Germany. This exam is conducted in front of a committee of 3 officials, and one of those officials must be a doctor. It is conducted in one of the medical chambers here in Germany. There are 4 parts to this exam. So the first part is the doctor-patient discussion. This part entails some history taking. That means that one of the officials, in most cases it will be the physician, will role play the patient, and you will have to ask him all the relevant questions to come up with some probable diagnosis and offer your treatment recommendation. This part takes some 20 minutes. The second part of the exam will be the documentation part, and you will have to be able to document all the information you collected during the first part. You will have to be able to document it in German. This part will also take some 20 minutes. The third part is the part in which you will have to present your patient to one of the officials. That means that is the discussion between the colleagues. In most cases, you are the resident and one of the officials will be your superior, and you will have to present him, the patient, what you think your diagnosis will be in this case, and your thoughts about the diagnosis, and what would you be offering in terms of treatment recommendation. The fourth part of this exam is the translation part. That means that you must be able to translate some complicated German medical terms into plain German, and vice versa. You will have to be able to translate some simple terms into more complicated professional medical terms. What you need to remember when it comes to the Fachsprachprüfung, that this test might differ between the different Bundesländer, because every single land or every single Bundesland in Germany carries out its own Fachsprachprüfung tests. So those might differ. How do they differ? Let's say that in some cases, you will have some simple internal medicine cases, while in other Bundesländer, they will also include some surgical or emergency cases. Another example will be some committees will include only physicians, while others will also include a linguist in the committee. But generally speaking, the structures are pretty similar. What else you need to remember? That during this test, not only your German is tested, but also your ability to carry yourself with your colleagues as well as with your patient. What do I mean by that? For example, if the person who is playing the role, the physician, is exhibiting some signs of stress or fear. You must be able to showcase, to demonstrate some empathy. You must be able to calm him down. Of course, everything in German. Another thing to remember is that if you do not understand something during the test, or if the so-called patient is speaking with you in some dialect or is speaking way too fast, you are obligated during the exam to ask them to speak Hochdeutsch, which is the standard German language accepted nationwide. Yeah, those are small nuances that you must consider while going into the exam. Generally speaking, if you are coming prepared to the exam, it's not about perfection. It's just about your ability to communicate safely. On a personal note, while going into the Fachsprachprüfung, I have received the case of pregnancy, which I haven't come across while preparing for the test. But I was able still to pass the exam with flying colors because I asked all the right questions. I was able to exhibit some empathy. I was able to communicate with my patient, with my colleagues, and that is why I passed the exam. So, as I said, it's not about perfection, just about being able to communicate and to be able to understand your colleagues and your patients. So, to summarize this video, it is safe to say that the Fachsprachprüfung is a turning point in your career as a doctor in Germany, but it's less daunting than it seems if you come prepared for it. In the meantime, I wish you the best of luck and I hope to see you soon in our next video.